Dr. H., go ahead.
I'm Dr. John Hellerstedt. I'm the Commissioner for the Texas Department of State Health Services, and this is a very auspicious occasion. The Governor and I are going to receive our doses of COVID-19 vaccine, and we're very excited about it. The purpose for doing this is to show you that we truly trust that this is a safe and effective vaccine. There is a lot of, if you will, vaccine enthusiasm and vaccine eagerness that's out there in the state of Texas. That couldn't be better. We really want to sustain that. And over time, as we get more and more and more vaccine, this will eventually be what puts the pandemic behind us and makes the pandemic a part of history. And I know we all can't wait for that to happen. In the meantime, though, we need to remember what it is that got us here. What it got us here is a success of doing the kind of infection prevention and control measures that have worked so far. So the physical, social distancing, the wearing of masks in public, and all of those other things. Never forget, that is what made us successful. That got us to where we are today, to now where we have a real game changer in the form of effective, safe and effective vaccines. These vaccines are so effective, they're really, if you will, a platinum standard for the effectiveness of vaccines. So we're very blessed by that. And with that, I'll turn it over to the Governor.
Sure. Thank you, Dr. Hellerstedt, and thank you for being the top doctor in the state of Texas, representing the state of Texas. And I want to thank you for your leadership, but also I want to thank the frontline workers I had a chance to visit with earlier, but all of the doctors and nurses, whether it be here or across the entire state of Texas, for being on the front lines of this war against this pandemic. They put their lives on the line to help the lives of others. We cannot thank them enough, and that's exactly why they have been at the front of the line of the vaccines that we've been distributing across the entire state of Texas. By the end of this week, we will have distributed more than 800,000 vaccines across Texas. By the end of this month, there will be more than 1 million vaccines distributed across the state of Texas. Then in the coming months, in January and February, the number of vaccines will just continue to increase. And so there will come a time when there will be availability for everybody to have a vaccine. And we want to make sure that people in the state of Texas can have trust and confidence in this vaccine. Along those lines, there was a report that came out recently that showed that more than half of Texans were either unwilling or unsure about taking the vaccine because maybe of some concerns about it. And that's exactly why we are here today. Dr. Redfield, the director of the CDC, Secretary Azar, the Secretary of Federal Health and Human Services, and Dr. Hellerstedt have all said that it's very important for leaders like governors to step up and make sure they show the public by getting a vaccine in front of a TV camera to show that this is a very safe and very easy process. And that's exactly what I'm going to be doing today. I want to show my fellow Texans that it's safe and easy to get the vaccine, and also remembering that I will never ask any Texan to do something that I'm not willing to do myself. So I'm going to step up, I'm going to take the vaccine, and show you everything's going to be just fine.
Can you tell us why Texas has chosen to not follow the CDC's recommendations?
Questions, Brad? We're going to get vaccinated.
Get vaccinated here real quick. Yeah, sure.
So I understand you'd like this in your left arm, right,
Sure.
Governor?
Say it again now.
I said I'm feeling well
Feeling
today.
perfect. Is that high enough for you?
Everyone was perfect at working on all the stuff.
Okay. Didn't give a thing. Great job.
That's it, thank you.
Thank you. Is that easy?
I'm ready. Excuse me.
Left arm, okay? Yes.
I have extra large hands going into large gloves.
We should have some music.
Are those one size fit all?
They're small, medium, and large, but I needed the extra large today. Are you feeling okay today?
Yes, I am.
Any allergies or reactions to medication?
No.
Okay. One more. You on this arm?
Yeah.
Okay. COVID-19 vaccine from today.
Very good.
Okay. 1, 2, 3.
Piece of cake. More prodding, Cody.
Thank you.
All right, thanks, y'all.
Thank you all very much.
Can you tell us why Texas isn't following the CDC's recommendation
Wait,
of who gets vaccinated next?
you deserve it. Answer your question. We're going to send you one.
Thank you.
Yeah,
You can't answer now?
I can, but we'll send it to you here shortly.
Okay, and are you able to tell us why you decided today is the best day for you to get the vaccine?
Yesterday, I talked to Dr. Redfield of the CDC, Secretary Azar of Health and Human Services, and they said it's important for governors to step up and be examples in their community to show that these vaccines are very easy to get, very safe to get. And then you couple that with the study that we've had here in the state of Texas that showed that more than half of the people in the state of Texas are apprehensive about getting the vaccine. We want to encourage people to get the vaccine by showing how easy it is. And so this is a way of demonstrating to the public, I took the vaccine, here I am, suffering no problems whatsoever, and that we encourage others to follow the example that Dr. Hellerstedt and I have set today, and that is step up and be able to get the vaccine.
Will we see changes to restrictions and precautions when more people have the vaccine?
And that's our expectation.